directly at the lung only. So then doctor will say, suppose if it is originated in the stomach and it is not showing any relation with the stomach, that means we can understand what is the relationship of that cancer with the stomach. The example is, suppose if somebody is in the relationship, suppose if the son says to the father, I don't know you, I have never seen you. So it's a strange. So similarly, the cancer cell says to the normal cells, we are different. We are totally different. So that is undifferentiated, and that particular time, this cancer marker will increase. Now in a healthy, they have given about nanogram, forget about the terminology, but 0.0 to 0.3, 3 units and greater than 10. Just understand the units. Now let's see in non-smokers, the units, you can understand in smokers, the units are increasing, 19. It is more. And we are just talking about healthy and smokers. But we are not talking yet about the cancer. In the cancer of the breast, and cancer of the ovary, cancer pulmonary, this is increase in the number. So what this shows is not only in the cancer conditions, but also in the non-cancerous conditions, it also increases, even by smoking. So carcinoembryonic antigen is not a real specific cancer marker. But even then it is useful for the cancers of the stomach and ovarian cancer, this pulmonary cancer. So the monitor could be colorectal, yes, colorectal, breast and the lung cancer. So it is a monitor for the 3 types of cancer. Colorectal, that is large intestine cancer, that is number 1. Another thing is a breast cancer, and in case of lung cancer. What is a monitor? Monitor means this marker, although it is not having a specificity, we can definitely make use of this kind of a marker, because when the cancer is diagnosed, first when the cancer specialist will diagnose it is a cancer with the pathologist, then it is easier now to use this. So it is not because of non-cancerous. Cancer is there. So first is to diagnose about the cancer and then further investigations. So that is called as monitoring. So monitoring is possible with 3 different types of cancer, and the cost of this particular test is 600 rupees for this particular marker. There is another marker which is called as CA125. In early ovarian cancer, it is elevated in 50%. But what about other 50%? It is not elevated. It is not increased. In pregnancy also it increases. In ovarian cyst also increases. Even in appendicitis, this marker increases. So it's not a specific for ovarian cancer. It is other cancers, it is present. Uterine cancer, it is increased. Colon cancer, that is large intestine cancer. Lung cancer. Pancreatic cancer also it increases. And this is a report given in the cancer control. So in cancer control, January 2001, it is the importance of this marker is given. The cost for this test is 950 rupees per test. And this is not a single test. They have to do it repeatedly as the doctor feels whether the cancer control is there or not after the diagnosis. CA125 is a lack of sensitivity for early stage disease. What I told you, the lack of sensitivity in patient stage have elevated lack of specificity. The normal values of CA125 may vary slightly among individuals. Laboratories, in most laboratories, the normal value is less than 35 units. So it will be 0 to 35 units is a CA125 in combination with transvaginal sonography, a kind of a sonography, may have a role in early detection of ovarian cancer. So CA125 is a marker basically for ovarian cancer. Those who are having ovarian cancer, the doctor will write down CA125. Why? Because CA125 is detected in 50%. But to increase the sensitivity, to increase the rather specificity of this type of marker, the sonography is also done. If sonography is done, the early detection is possible. Late detection we don't want. We want early detection. Late detection is possible. We don't want means it is going to be useful. But we will be happy, a doctor will be happy if it is early detection. And early detection is possible with sonography as well as by this particular test. Now the last is National Institute of Health in America. Their statement says that those recommended that women undergo at least annual rectovaginal pelvic examination and TVS, that is sonography and pelvic examination, and CA-125 is measured, useful in monitoring ovarian cancer recurrence and the treatment, and not useful for screening. Actually, it is not useful for screening, but it is useful for. But NIH says, what is important in the NIH is those who are having hereditary connection. That means suppose if the mother is having ovarian cancer, then the daughter should do these particular repeatedly tests to rule out the ovarian cancer. What? Sonography as well as this particular test of CA-125. But it is not a diagnostic. It is not that all the women should do this test because it is not a specific. Now this CA-15-3 is not specific sensitive enough to detect early breast cancer. This is for breast cancer. So one I have taken is ovarian cancer. One was large intestine, that is CEA. Another thing is CA-125 for the ovarian cancer. This is for the breast cancer. And the last one will be for a prostate. So I have selected only 4. The CA-15.3 is not specific or sensitive enough to detect early breast cancer. Therefore, while a low value of CA-15.3 did not rule out a carcinoma, an elevated value suggests malignancy. Very interesting part. If low value is there, it cannot rule out there is no cancer. But if the high value is there, definitely cancer is there in this CA-15.3. And the cost of this, as a rule, it should be used after breast cancer has been diagnosed. This is very important, underlining thing. If the breast cancer is not been diagnosed, just for normal, all the women after 40 or 50 should not go to the doctor and do it. If they have got enough money, 950 rupees, doesn't matter. I would like to know whether the breast cancer is there or not. It's a wrong thing. Because it's not for a general population, as there is no sensitivity. If the sensitivity and specificity is there, for any marker tomorrow, the people will go and do that kind of marking. For example, BRCA1 and BRCA2 is oncogenes in the breast cancer, which are so specific that in USA, before getting a job, they asked to do these 2 antigen specificity, BRCA1, BRCA2, for the women, so that that lady should not be a burden from health point of view to the organization. So they have to rule it out from LIC point of view, that it is negative, and then only the jobs are offered. But this was way back in 1995. I don't know present what is the condition. Now the CA-15.3, if you want to use it, as a rule, it should be used after breast cancer has been diagnosed. Once it is diagnosed, you can use it to monitor it. Okay? And CA-53 may be elevated in the lung, ovarian, even colorectal cancer. But once it is diagnosed, it is definitely breast cancer and breast cancer related, so one can get some kind of idea. Then the next thing is alkaline phosphatase as a predictive of breast cancer recurrence. If you want to predict the cancer in a breast cancer related, alkaline phosphatase is an enzymatic test, which if it is done along with this test, it will give information, very good information. And the cost for the test is 950 rupees. Now the last test is prostate specific antigen or PSA. The normal range is 0 to 4 nanogram per ml. As now you know it very well, because in the beginning only I have told you that anything 4.5, below 4.5 is not cancerous, but above 4.5 it may be a cancerous. But in a prostate-specific antigen also, there is a problem. It may be not cancerous, but increase in the size of the prostate, a benign prostate hypertrophy. Hypertrophy means increase in the size of the organ. So which is a very normal thing after in aged persons. So after 60 or so, this is very common. So how to know whether it is because of just inflammation? Prostatitis, as tonsillitis is inflammation of tonsil, prostatitis is inflammation of prostate. So how to know it? So you can know it by doing other tests. A high prostate cancer also elevates in benign prostate, hypertrophy and prostatitis. So some other screening tests will be required. Useful in diagnosis of prostate cancer, prognostic cancer, and monitor recurrence. This is important, recurrence to the treatment. If the treatment and the prostate cancer is recurring, one would know and help in doctor to diagnose that. And the test cost is 620 rupees. So, in short, what we have studied is about 4 tumor marker tests. The CA-125 is a test which is for the ovarian cancer, but which is not specific for ovarian cancer. The breast cancer is CA-15.3, that is also not specific, but we can monitor after the diagnosis. Most of the cases we can monitor after the diagnosis. And there is another test which is called as the CEA, that is carcinoembryonic antigen. That particular test is useful in case of large intestine cancer or colorectal cancer. Initially, the first cancer marker which I have showed in my slide is CEA. You need not know the long form, but CEA. That CEA was discovered in 1960. And then in 1970 to 1980, all other tumor markers started getting, because there is a technology which is called as the immunological techniques called as monoclonal antibodies. During 1975, the scientists got Nobel Prize for the monoclonal antibodies. And since that, they could discover many more cancer tumor markers. So idea to deliver this particular topic was, idea is to know you, because what happens, suppose if you go to the pathologist and say, pathologist says 650 rupees, he said the sugar, normal sugar, blood sugar is maybe 50 rupees or maybe 100 rupees, not more than 100 rupees in the normal laboratory. Why it is 950 rupees? So that should not happen. You have got some idea that it is around that price. This I got from one particular laboratory, the prices are approximate prices. And another thing is, you can insist even to the doctor, along with the marker, is it possible to use some other markers along with it, or do you feel that the sonography is the essential in this particular thing to increase the sensitivity and effectivity of the marker? So you can get value for the money. You means the society can get value for the money, whatever they are spending it. They will know it, okay, this is the cost. Thank you. Any questions you can ask?